My name is Katie Greniger, and I am an FNP student at the University of North Dakota College of Nursing, and this is my independent study research on the comparison of effectiveness of semaglutide versus liraglutide as anti-obesity medications. We're all well aware of our increasing rates of obesity and the comorbid effects on the adult population, and this is really depicted in the graph below showing our increasing rates with this. It has been discovered that a weight loss of just 5 to 15% is correlated with a risk reduction of several obesity-related complications such as hypertension, hyperlipidemia, and diabetes. But we know that weight loss can be very difficult for patients to achieve with just lifestyle interventions alone. There are several anti-obesity medications that are indicated for use when the BMI is greater than 30 or 27 if there are other obesity-related comorbidities. And it's estimated that 46% of the American population meets the treatment criteria for the use of these anti-obesity medications. However, only about 2% of these patients are actually receiving treatment with anti-obesity medications. Two of the more recently approved medications for weight loss are semaglutide and liraglutide. Both of these medications were first used for the treatment of diabetes, and it was found that they have properties that help patients to lose weight. And they were later then approved by the FDA for weight loss. Liraglutide was first approved, and then later semaglutide was approved. They're both from the same class of medications, which are glucagon-like peptide-1 receptor agonists. And so in my research to discover which of these medications was superior in producing the greatest weight loss for patients, I conducted a scoping review and utilized randomized controlled trials, systematic reviews, and meta-analysis. I searched PubMed, CINAHL, Clinical Key, and Google Scholar and utilized articles within the last 5 years. These articles included an adult sample that had a BMI greater than 30 or 27 with at least one obesity-related comorbidity. These patients had to have treatment with semaglutide or liraglutide and be compared to placebo, diet and exercise, and or other anti-obesity medications. And the exclusion criteria was these two medications being utilized for the treatment of diabetes or other health conditions. I also excluded pediatric samples. So in my results, actually both medications are effective in reducing weight for overweight and obese adults. Both medications are effective the most when combined with diet and exercise, and both of them have very similar side effect profiles, which are really just mild GI effects. It was found in my research that semaglutide is the superior medication over liraglutide in producing a greater percentage of weight loss. And there are a couple really nice graphs here that depict this information. Semaglutide is typically started out low and titrated up, and this helps patients to have less of those GI side effects. And so you can see the amount of weight loss over a 52-week period at each dosage level, and then the orange line shows liraglutide, which is typically dosed at 3.0 milligrams, and the graph also shows the weight loss versus placebo. So really great graphical information there, kind of what I've been talking about. Semaglutide shows superior over liraglutide in the effect on weight loss in adults who are overweight or obese. And the safety and efficacy of semaglutide combined with the longer half-life does improve the medication adherence and continuation in patients. Semaglutide is a once-weekly injection, whereas liraglutide is a daily medication. So that's a really nice option for patients. Semaglutide was also found to have superiority over liraglutide in the management of metabolic conditions such as hypertension. So it was found that while these patients were on semaglutide, that there was a reduction in blood pressure as well. So that was a nice feature. So the implications for practice, really the biggest thing is just getting clinicians to be aware of the options for treatment for patients who have struggled to lose weight with non-pharmacologic measures alone. When we looked at that, 46% of Americans that meet the criteria and only 2% that actually receive treatment. That's a pretty big jump there. So that is the biggest thing is just education for our clinicians. And then the next 2 slides are my references, and so I thank you for listening to my research.